Let me teach you how to find skin cancer on your body. I'm a dermatologist who does full body skin exams every day, and I'm going to be reviewing some of the signs that I look for when evaluating for skin cancer, specifically basal cell carcinoma. Basal cell carcinoma is the most common type of skin cancer, and it can truly occur on anyone. Typically, it happens from intermittent blasts of UV exposure. Sunburns, maybe a person lives in a cold environment, and every spring or summertime they like to go to the beach and get their tan. Those are your intermittent blasts. It really can happen anywhere head to toe. Here's some classic places where I find it, especially in sunny climates: the hair parting, the face, the most common location, this nasal alar crease area on the neck, on the arms, and also on the legs, especially in women on the legs because of typical shaving practices. There's a couple different types of basal cell carcinomas. There's the superficial basal cell carcinoma, which looks like a bright red spot, and when you rub on it, it turns even more red pink. The nodular basal cell carcinoma, that one kind of looks like a non healing acne type lesion or maybe a skin colored mole, but it doesn't go away and it tends to slowly grow and it tends to intermittently bleed. Pigmented basal cell carcinoma, now this one can look like a mole because there's some pigment to it, but again, it bleeds and it can crust. Morpheaform basal cell carcinoma, that one almost looks like a scar, an indentation in the skin. And it's actually just skin cancer that's changing the dermis within the skin. Basal cell carcinoma is great because it is slow growing and rarely does it metastasize around the body, meaning that it's not like some of the other cancers that could end up in your liver, your brain, but especially on the face in the more aggressive subtypes, it could actually find where your facial nerves are and grow and track along in it and actually end up in the brain. This so called perineural invasion is a severe complication of basal cell carcinoma. And a lot of times, not only do patients need surgical treatment, but they also need radiation too. To prevent developing basal cell carcinoma, make sure you are so good with wearing your UPF clothing, with applying an SPF 30 or higher sunscreen every day and then reapply every 2 hours, especially when you are being exposed to UV radiation, whether that's next to a window or going outside. Do your monthly self skin checks and link up with a dermatologist if you have any questions or concerns.